Hello everyone. Today we will talk or learn about the pathophysiology of osteoarthritis or OE. So in this case, the patient is 70 years old female and she came to hospital with the complaint of knee pain at the knee joint, and the doctor diagnosed as osteoarthritis, and she has underlying hypertension. So now we'll further go deeper into the pathophysiology of osteoarthritis. So first we will talk about the risk factor for osteoarthritis. In my case, the patient is 70 years old, which means she is elderly, and elderly have higher risk for osteoarthritis. And next risk factor is mechanical stress. The more we use our joint, the more it has risks for getting the osteoarthritis. So this two risk factor, it leads to decreased chondrocyte function. So chondrocyte here is a stem cell that helps in production of cartilage. So cartilage is important to connect our bones and bone together. And inside cartilage we also have proteoglycan and collagen. That proteoglycan is a cell that helps to keep the cartilage very soft and hydrated. So if there is no proteoglycan, that means our cartilage will become very dry and it will not be able to function well. So when there is a decrease in chondrocyte and decrease in proteoglycan and collagen, it will lead to increased cartilage breakdown. And when there is an increased cartilage breakdown, it is known as cartilage degeneration. So another factor that causes cartilage degeneration is the underlying hypertension. Since my patient has hypertension, it will lead to microvascular damage. So microvascular damage, which also means vasoconstriction. So vasoconstriction in hypertension, normally we have vasoconstriction. So when there is a when the vessel constrict, there will be less blood supply to the subchondral bone. So subchondral bone here is this bone in the picture. So when there is an reduced blood supply to this bone, the blood cannot go up here, right? So this white surface here, this one is the cartilage. So when there is no blood supply here, the blood will not reach here, and there will be no supply of nutrients to the cartilage here. So when there is no blood supply to the cartilage, of course the cartilage will degenerate, or it will break down by itself and lead to cartilage degeneration. And when the cartilage degenerate, it will cause the symptoms in the patient such as crepitus, morning stiffness, or mild swelling of the knee joint. And the process of cartilage degeneration, first it will become very soft, and after that it will become very thin, and after thinning it will dissolve or erode. So when it dissolves, it will release its like fragments or little fragments of the cartilage in the joint, or we call it synovial space. So this space around the bone or the joint here, we call it synovial space. So when there is a release of fragments into the synovial space, it will lead to synovial inflammation. And when there is inflammation, of course our body will release cytokine enzymes such as interleukins, and this inflammation of synovial space or joint, it will cause further joint destruction in our joint, and also loss of joint cushioning here. So when there is a loss of joint, there is increased joint destruction, so there is no cartilage here, so the space between these two bones, it will reduce. And subchondral bone, so this bone will be very hard. Subchondral bone is here, it will become very hard, and then osteophytes or bone spur. So this is the bone spur, or small bones will start to appear here, since our body tries to replace our fragmented bones. So